Question 191. Which blood pressure reading would you report to the nurse? A. 118 per 78. B. 96 per 64. C. 128 per 80. D. 144 per 92. Answer D. Explanation. Hypertension is diagnosed when a person has consistent blood pressure measurements of 140 per 90 or greater. Hypertension has no symptoms as it develops. It can be present for years without a person knowing it. If untreated, it can cause heart failure and stroke. Question 192. A patient has just finished taking a cold beverage. How long should you wait before taking an oral temperature? A. 45 to 60 minutes. B. 15 to 20 minutes. C. It can be taken immediately. D. 20 to 45 minutes. Answer B. Explanation. To take an oral temperature, make sure the client has not had anything hot or cold to eat or drink, and has not smoked for 15 to 20 minutes. Place the thermometer under the client's tongue. A digital thermometer will beep when it registers the client's temperature. A glass thermometer will have a line that stops moving when it gives the reading. In an adult, a fever is considered to be greater than 38 degrees C. For children, a fever is 37.5 degrees C. Question 193. Which of the following diet has no food restrictions? A. Diabetic. B. Soft. C. Regular. D. Low sodium. Answer C. Explanation. A regular diet has no restrictions regarding salt, sugar, or texture. A patient can have any foods they wish. Low-sodium diets have strict salt limits, and diabetic diets restrict sugar and carbohydrates. A soft diet has foods that are easy to chew and swallow. Question 194. Which specialist is responsible for assisting residents to do everyday activities? A. Physical therapist. B. Occupational therapist. C. Activities coordinator. D. Physiotherapist. Answer B. Explanation. An occupational therapist helps patients who are disabled or who have been injured develop or regain the skills needed for daily activities. They may teach a resident who has had a stroke to get dressed or use special devices to assist with eating. Question 195. What is an embolism? A. When a blood vessel bursts and bleeds inside of the brain. B. A blood clot that moves through the bloodstream and causes obstruction. C. A bubble of air that blocks blood flow in arteries, causing an IV to stop. D. When an artery begins to clot due to damage and causes obstruction. Answer B. Explanation. An embolism is usually a blood clot that travels through the bloodstream and becomes stuck in an artery or vein. It blocks blood flow, leading to tissue damage and possibly death. Fat or air can also cause an embolism. An embolism is a medical emergency. Question 196. When calculating total fluid intake during a 24-hour period, all the following should be included except A. Any IV fluids. B. Any eye or skin ointments that are absorbed. C. Pudding per ounce by mouth. D. Any liquids per ounce by mouth. Answer B. Explanation. Intake and output measure the fluid balance in the body. To calculate input, add all liquids plus foods that are liquid at room temperature, such as ice cream, ice pops, and jello. Pudding is also included because it is mostly milk. Question 197. Which one of the following amounts is the proper way to record urinary output? A. 1 pint, B. 2 cups, C. 480 cc, D. 16 ounces. Answer C. Explanation. Medical and pharmacy measurements use the metric system. 1 ounce equals 30 cc or 30 millimeters. 16 ounces equals 480 cc's or millimeters. Question 198. A slip knot is used when securing a restraint so that A. The restraint can be removed quickly when needed. B. It can be easily observed whether the restraint is applied correctly. C. The restraint cannot be removed by the resident. D. Body alignment is maintained while wearing the restraint. Answer A. Explanation. A slip knot is secure but can be easily released in an emergency using one hand. It is also called a half bow or quick release knot. Question 199. A resident has diabetes, which is a common sign of a low blood sugar. A. Thirst, B. Shakiness, C. Fever, D. Incontinence. Answer B. Explanation. Hypoglycemia or low blood sugar causes the diabetic to become shaky. Other signs and symptoms are sweating, chills, nausea, and a rapid heartbeat. The resident may act confused, irritable, or anxious. As a CNA, you should know which residents are diabetic and what to watch for. Notify the nurse immediately. Question 200. Which symptoms best indicate an instance of urinary tract infection? A. Urine that appears to be cloudy. B. Burning or stinging sensation when urinating. C. The need to urinate more frequently. D. All of the above. Answer D. Explanation. A urinary tract infection (UTI) can cause several important signs and symptoms. The patient may feel an urgent need to urinate, but when on the toilet, actually have a few dripples of urine. There can be pain, burning, or stinging while trying to urinate. The urine may appear cloudy or even have streaks or spots of blood. Always report any of this to the nurse. Thank you for watching.